नमस्ते बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Hemolytic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about hemolytic anemia. In the last lecture, we have discussed about the classification, the anemia, its classification, and we have also discussed about iron deficiency anemia. I believe you must all have gone through the topic from the book and you must all have prepared your notes from that. Now today, let's start with the hemolytic anemia. What is hemolytic anemia? Now, hemolytic anemias are, as we have discussed previously, that anemia, what is anemia? Anemia is basically the reduction of number of circulating RBCs. And in hemolytic anemia, what is happening? As the name suggests, hemo and lysis means destruction of the RBCs. So in this particular type of anemia, hemolytic anemia, there is excessive destruction of the RBCs, circulating RBCs, and there is premature destruction of the RBCs. So the number of, there is great reduction in the number of circulating RBCs, leading to the development of hemolytic anemias. Now, the hemolytic anemias can be inherited or acquired. So these can be inherited or it can be acquired. So from the clinical point of view, the hemolytic anemia can be acute. It can be more acute or more chronic. So anemias are due to the reduced number of circulating red cells from their premature destructions. And these, the hemolytic anemias can be inherited or it can be acquired. And from the clinical point of view, they may be more acute or maybe more chronic. So there can be acute hemolytic anemia or there can be chronic hemolytic anemia. The severity of the hemolytic anemia varies from mild to very severe type of anemias. So hemolytic anemia can be mild when there is less destruction of the RBCs, or it can be severe when there is excessive destruction of the RBCs. Now, based on the site of hemolysis, the site at which the hemolysis is happening, it can be intravascular or extravascular. So hemolytic anemias, it can be acute or chronic, it can be mild to severe, it can be inherited or acquired, it can be intravascular or extravascular type. With respect to mechanism, the mechanism that is involved, hemolytic anemias may be, it can be due to intracorpuscular or extracorpuscular. So there can be mild to severe, there can be intravascular, extravascular, it can be inherited, it can be acquired, or it can be intravascular or extravascular. And with respect to the mechanism, it can be intracorpuscular or extracorpuscular. So based on the pathophysiology that is involved in the destruction of the RBCs, it is classified according to the different types. So it can be acute or chronic, it can be inherited or acquired, it can be intravascular or extravascular, it can be mild to severe. And with respect to the mechanism, it can be intracorpuscular or extracorpuscular. Now, what is the classification? The classification of the hemolytic anemias. In the classification of hemolytic anemias, there can be intrinsic RBC abnormality. So in hemolytic anemia, there can be intrinsic RBC abnormality that can be seen with reference to the membrane defect. So in the membrane defect, there can be various membrane defect that could be observed in case of hemolytic anemias. So the membrane defect that occurs in case of hemolytic anemia includes hereditary spherocytosis. There can be hereditary elliptocytosis. There can be different type of metabolic defects in the shunt pathway. In the shunt pathway, that includes glucose 6-phosphate dehydrogenase deficiency. There can be Embden-Meyerhof pathway defect that can be due to the pyruvate kinase deficiency. There can also be hemoglobin defect. There are different type of structural defects, which includes sickle cell hemoglobin, HBC, HBE, and unstable hemoglobinopathies. Now, next we come to the synthesis. There can be synthesis defect, which is seen in case of thalassemia syndrome. So classification of hemolytic anemia can be done on two bases: intrinsic RBC abnormality and the extrinsic RBC abnormality. In the intrinsic RBC abnormality, we have seen different type of abnormalities like hereditary spherocytosis, hereditary elliptocytosis, metabolic defects. We have shunt defects, which includes glucose 6-phosphate dehydrogenase deficiency. We have Embden-Meyerhof pathway, which includes pyruvate kinase deficiency. Next, we have hemoglobin defect. We have structural defect, which include HBS, HBC, and HBE, unstable hemoglobinopathies. Next, we have synthesis defect, which includes thalassemia syndrome. Next, we come to the extrinsic RBC abnormality. Extrinsic RBC abnormality, it can be antibody mediated or non-antibody mediated. So extrinsic RBC abnormality can be of two types. One is antibody mediated and the next is non-antibody mediated. In the antibody mediated extrinsic RBC abnormality, there will be blood group incompatibility. Blood group incompatibility with hemolytic blood transfusion reaction that occurs in ABO and RH incompatibilities. There can be hemolytic disease of the newborn. And the third variety is the autoimmune hemolysis. So in the extrinsic RBC abnormality, we have two types of abnormalities. One is antibody mediated and the second one is the non-antibody mediated. In the antibody mediated, we have blood group incompatibility. We have hemolytic blood transfusion reaction, which includes ABO and RH. Next, we have hemolytic disease of the newborn and autoimmune hemolysis. There are other non-antibody mediated reactions, which includes RBC fragmentation. So there is RBC fragmentation. We have thrombotic thrombocytopenic purpura. We have preeclampsia, toxemia, infection, Plasmodium falciparum malaria. We will also have Clostridium belchi, infectious mononucleosis. So non-antibody mediated will be seen in case of RBC fragmentation, infections, chemicals, and drugs. So in the RBC fragmentation, we will see thrombocytic thrombocytopenic purpura, preeclampsia syndrome, and infections. In infection, we will see Plasmodium falciparum malaria, Clostridium belchi, and infectious mononucleosis. In the chemicals and drug damage, we will see antioxidant drugs, which includes glucose 6-phosphate deficiency, dapsone, and burns. These all are responsible for the destruction of the RBCs or the non-antibody mediated mechanism. Now, how to recognize a case of hemolytic state? Whenever a case is coming to you, then how will you recognize that this is the case of hemolytic anemia? So recognizing the state, hemolytic state, we are going to observe following thing. Number one, we will be checking for the evidence of RBC destruction. So in the evidence of RBC destruction, we are going to see for anemia, we are going to see for spherocytosis. We are also going to check for increased urobilinogen, increased unconjugated bilirubin. So in order to recognize hemolytic state, we are going to check for four things. What are the four different things that we are going to check for? We are going to check for four things that includes evidence of RBC destruction, evidence of increased rate of red cell production, compensatory mechanism, and associated effect of the hemolytic states. So in order to recognize the hemolytic state, we have to check for the evidence of RBC destruction. We have to check for the evidence of increased rate of red cell production. We are going to check for the compensatory mechanism, and we are going to check for the associated effects of the hemolytic states. So in order to recognize the hemolytic state, number one, evidence of RBC destruction. That will be seen in case of anemia, spherocytosis, increased urobilinogen, increased unconjugated bilirubin. And in the second, in order to check for the evidence of the increased rate of red cell production, we are going to check for bone marrow expansion and hypercellularity. In order to check for the compensatory mechanism, that includes erythroid hyperplasia. In order to check for the associated effects of hemolytic state, we are going to check for the depletion of the folate stores, hypertrophy of the spleen. Now we come to the hemoglobinopathies. Hemoglobinopathies is another important cause of hemolysis, that is destruction of the RBCs leading to the hemolytic anemia. So what is hemoglobinopathies? Hemoglobinopathies are basically the disorders that are affecting the structures, function, and production of the hemoglobin. So what is a hemoglobinopathy? Hemoglobinopathy is basically affecting the structure, function, and uh, production of the hemoglobin. And the disease is caused by dysfunction of the genes and encoding the globin chain of the hemoglobin molecule. There are different types of hemoglobin that are produced during the embryonic phase of the adult life. And normal hemoglobin is comprised of 2 alpha chain and 2 non-alpha chains. So what is the different type of classification of hemoglobinopathies? What are the different type of hemoglobinopathies? All these things we are going to discuss in the next lecture. In today's lecture, we have only discussed about the various factors that are responsible for the excessive destruction of the cells leading to hemolytic anemias. So the classification we are going to discuss in the next lecture. So I believe you must have understood this session properly. This is a little bit tricky topic because you have to just go through the notes again, and I have uploaded the e-notes because this classification is important for you to understand the different type of hemoglobinopathies. We get a full question on hemoglobinopathies. So it's your homework to just go through the e-notes that I have uploaded once again. And then in the next lecture, I'm going to revise all these topics once again, and we are going to move ahead with the hemoglobinopathies. So this was all for today. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you have understood this session properly. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.